Mr. X developed quadriplegia following a diving accident. The most likely cause is option A C4 injury, option B T3 injury, option C L3 injury, option D T6 injury. The correct answer is option A C4 injury. The symptoms of C4 spinal cord injury are loss of diaphragm function, limited range of motion, quadriplegia, trouble in controlling bladder and bowel movements. Which of the following clinical manifestations would support a nursing diagnosis of decreased cardiac output? Option A cold, moist skin. Option B bouncing peripheral pulses. Option C increased urinary output. Option D diminished breath sounds. The correct answer is option A cold, moist skin. Signs and symptoms of decreased cardiac output: abnormal heart sounds, angina, anxiety, changes in level of consciousness, decreased activity tolerance, hypotension, tachycardia or bradycardia, raised jugular venous pressure, breathlessness and hypoxemia, oliguria and anuria. Evidence of pulmonary edema and peripheral edema, thready pulse. World Hand Hygiene Day is observed on option A 5th May, option B 7th April, option C 1st December, option D 30th May. The correct answer is option A 5th May. The World Hand Hygiene Day 2022 slogan is Unite for Safety and Clean Your Hands. 2021 slogan is Second saves lives, clean your hands. When performing cardiac compression on adult client, the nurse is aware that it is essential to exert vertical downward pressure which depresses the lower sternum at least. Option A 1/2 to 3/4 inch. Option B 3/4 to 1 inch. Option C 3/4 to 1.5 inch. Option D 1.5 to 2 inch. The correct answer is option D 1.5 to 2 inches. While performing cardiac compression, the compression depth of at least 2 inches in adults and at least more than or equal to 1/3 inch in infants and children. If no advanced airway, the compression ventilation ratio in adult patient 30:2 and in pediatric patient 15:2. Once advanced airway in place, give one breath every seconds with continued chest compression. What should be the air pressure in operating room in relation to the outside air pressure? Option A lesser, option B greater, option C equal, option D no relation. The correct answer is option B greater. The positive pressure will be maintained in OT at operational and non-operational hours. It prevents outside air entry into the OT. Ventilator associated pneumonia prevention bundle includes all except option A semi-recumbent position, option B prophylactic antibiotic therapy, option C daily sedation vacation, option D frequent drainage of subglottic secretion. The correct answer is option B prophylactic antibiotic therapy. Ventilator associated pneumonia bundle is a set of intervention taken to prevent ventilator associated pneumonia. Ventilator associated pneumonia bundles include elevation of head of the bed to between 30 and 45 degrees, Daily oral care, daily sedation vacation, turn patient to back to side every 2 hours. Deep vein thrombosis prophylaxis start within 24 hours of start of mechanical ventilation. Peptic ulcer disease prophylaxis start within 24 hours of start of mechanical ventilation. Daily assessment of readiness to be extubate. Ventilator associated pneumonia is defined as pneumonia that develops option A after 5 days of intubation and ventilation. Option B after 48 hours of intubation and ventilation. Option C any time after intubation. Option D none of the above. The correct answer is option B after 48 hours of intubation and ventilation. Ventilator associated pneumonia is defined as pneumonia that develops 48 hours after a patient has been placed on mechanical ventilator. Lumbar puncture is done at level of option A L3 L4, option B L1 L2, option C L4 L5, option D T12 L1. The correct answer is option A L3 L4. Antibiotic prophylaxis before surgery is to be administered. Option A 120 minutes prior to incision. Option B 60 minutes prior to incision. Option C just before incision. Option D 120 minutes prior to shifting patient to OT. The correct answer is option B 60 minutes prior to incision.